welcome to my YouTube channel. This is Nursing with Annie on your screen. I think about nursing, health, lifestyle, and faith. And on today's video, this is a continuation from the last video of the May 2022 Nursing Council exams, and this is number 3 of the questions that was asked. I am making a continuation of the video from the last video I made, and this is the last question. It had to do with diagnostic investigations. Yeah, so welcome back to Nursing with Annie YouTube channel. I film about nursing, health, lifestyle, and faith. If this is a video you're interested in, sit back, relax, and enjoy. So you're welcome back. Like I said, this question was centered on diagnostic investigations to be carried out, and they gave a guideline, definition, indication, nursing responsibility. So for anyone who wrote the exam, for you to be able to know what to write, you follow the guidelines, which is the definition, indication, and nursing responsibility. So magnetic resonance imaging was the I, computed tomography, which is CT, was the second one, full blood count, and then ultrasound. So you have to answer these questions with the guidelines. So let's go to the first one, which is magnetic resonance imaging. First of all, the definition. So magnetic resonance imaging is a non-invasive diagnostic procedure. When I say non-invasive, it means there is no need to be piercing of the skin. There's no need to inject the skin or anything. It is non-invasive. You don't have to, get into the skin to carry out this procedure or get into the body with any piercing object. It is non-invasive and it uses the magnetic field for this procedure. Yeah, so the magnetic field is being used for this procedure. Now, indications. When is magnetic resonance imaging supposed to be carried out? That is what indication means. Indication in nursing means when are you supposed to do this, or what calls for this to be done. So for magnetic resonance imaging, visualization of the spine. Visualization of the spine is an indication for MRI. When you want to visualize the spine, you can go for MRI. The visualization of the brain also, visualization of the limbs, of the joints, the heart, the blood vessels, the abdomen and pelvis. So yeah, this is the indication for MRI. Now, when it comes to nursing responsibilities, what are you supposed to do as a nurse when it comes to MRI? Like when you have a patient who wants to go for MRI, as a nurse, what are you supposed to do? First of all, in nursing, you receive consent, then you explain the procedure to the patient. When I mean explain the procedure to the patient, you are going to tell this patient what this patient is supposed to do when it comes to this procedure. Yeah. And what this patient should expect when it comes to the procedure, and then you go through the doctor's order. If there's anything the doctor wants you to carry out for this patient before the procedure, you have to carry it out. Ask the patient for any allergies, ask the patient for health history. Is there any allergy that will make this patient not to go for this procedure? Is there anything that will make this patient not to go for this procedure? That is another nursing responsibility. Also, you should advise the patient or encourage the patient to remove any metallic object he or she might be wearing, remove jewelries, because like I said, this procedure has to do with magnetic field. So the patient is to remove any metallic object, any jewelry at all, anything that can cause an interference with the procedure. And also for patients who have tattoos, they are also required to cover that area with anything, because that tattoo can actually also prevent the procedure from the results from coming out the way they are supposed to come out. When it comes to nursing responsibility, we have before, during, and after. So the ones I've mentioned is before the procedure. Now, during the procedure, what should the nurse do? The nurse is to monitor this patient as the procedure is going on, observe for any reaction, any signs and symptoms abnormal, any reaction this patient might be going through, any reaction this patient might be responding to, the nurse is supposed to monitor this patient during the procedure. Like I was saying, I forgot to mention that before this procedure, the nurse should also allay fear and anxiety, because sometimes patient might be scared, to carry out this procedure. So you have to allay fear and anxiety from this patient, so the patient will be calm during the procedure. Yeah, so after the procedure, what should the nurse do? The nurse should also, if there's any particular position this patient should stay after the procedure, the nurse should ensure that the patient stays in that position. If there's anything the patient wants, the nurse should attend to the patient. If the patient is supposed to be on nip or oral before and after the procedure, the nurse should also ensure that. So that is that for MRI. Now we go to computed tomography, CT, what's popularly known as CT scan. Now, definition of CT scan. CT scan is a non-invasive procedure also. It's a non-invasive diagnostic procedure that either it can be done with or without contrast medium. When I mean contrast medium, I mean either iodine based or magnesium sulfate. So yeah, it can be done with or without contrast medium, either iodine or magnetic sulfate. So that's the definition for CT scan. Then when it comes to indication, when can you carry out this procedure? On what basis can you carry out this procedure? It is used to visualize specific tissues. It is also used to visualize organs or blood vessels. Yeah, it is also used to visualize organs or blood vessels, and the duration of the CT scan is, note this is very important, the duration of the CT scan is dependent on the area which the CT is going to scan. I don't know if you understand what I just said. The duration depends on the area being scanned. Yeah, basically. So the duration of CT scan is dependent on the area that is being scanned. The duration of scanning the head is different from the duration of scanning the breast. It's different from the duration of scanning the hands, scanning the legs. You know what I mean? Yeah, so that's that for the indication. Then now, nursing responsibilities. What should be done as a nurse before, during, and after CT scan? It still boils down to what I said earlier. They still go through that same circle. As a nurse, you obtain consent, explain the procedure to the patient, allay fear and anxiety, check any allergies, check health history, check the doctor's order. Is the patient supposed to eat before the CT scan? Is he supposed to empty bowel before the CT scan? All those things, you make sure you go through them. During the CT scan also, you also monitor these patients closely, observe for any allergy, observe for any reaction, observe for anything that might go wrong. And after the CT scan, like I said earlier, you also, make this patient comfortable. If there's any particular position the patient is supposed to be in, you ensure the patient is in that position. Make sure the patient is okay. If the patient needs to empty bowel, the patient does that. Yeah, so next is full blood count. This is a very popular procedure that is done in nursing, and as a nurse, you are going to encounter, or you would come across full blood count procedure as a nurse often, because it is a basic screening. Now I'm going to the definition. It's a basic screening procedure, and it is most ordered it's the most ordered lab test in most hospitals. So it is something that is kind of a routine procedure, because when you come to the hospital, one of the first investigations to be carried out is your blood test. Your blood is being taken and things to be checked are checked. So this is a basic screening test that is most ordered in the laboratories in most hospitals. Now, indications. When do you carry out full blood count? You carry out full blood count when you want to know the hemoglobin level of a patient, the hematocrit level of a patient. You want to know the red blood cells, the amount of the red blood cells in the patient, the white blood cells, the plasma, and all of that. Yeah, so nursing responsibilities. This has to do with taking the blood from the patient, and it has a procedure, it has the responsibilities that comes with it. It has responsibilities that come with it. So as a nurse who wants to take blood from a patient, before the procedure, you explain the procedure to the patient, Yeah, you explain the result to the patient, you obtain consent from the patient. After that, you check for the investigation, the particular things you're to do. And when it comes to withdrawing the blood, I think I'm going to make a full procedure. This is just like blood, what do they call it in nursing again? Blood collection of blood specimen. Yes. So when it comes to collection of blood specimen, after you have obtained consent from this patient, after you must have obtained consent from the patient, you position the patient, sitting down. It can be sitting down, it can be an upright position, and then you assemble the equipment you are to use. After assembling the equipment you are to use, you then tell the patient to stretch his or her hand, and then you tie a tourniquet around the patient. You then use the scavenging needle to and then you clean. Before then, you clean the site for collection of blood with a wet swab, alcohol swab. And after that, you tell the patient to fist or clench his hand, and then after you must have insert the scavenging needle or whatever supply that you were supplied with. You then withdraw the blood, telling the patient to release his or her hand, and then the blood is taken. So that is that for. And after you must have collected the blood, you put it in a bottle, a specimen bottle, with the details of the patient on it, the date and time of collection, the lab in you are taking the results, the specimen to. Every information that will be used to identify this patient should be on the specimen bottle. And that's that for full blood count. Now when it comes to ultrasound, which is the last one, ultrasound, full blood, don't forget, full blood count is an invasive procedure. Reason is because you are using a needle or whatever to pierce into the body or the skin or what. Yeah, so this is an invasive procedure. Then ultrasound, this has to do with, is a non-invasive procedure that uses sound waves to produce images or structures in the body. And one ultrasound procedure that we are very, very conversant with is ultrasound for pregnancy scan. And this is done to know where the location of the baby, the position of the baby, the sex of the baby, to hear the fetal heartbeat and all that. It's also used to check for abnormalities in an unborn fetus. So that is the indication for ultrasound. Then when it comes to nursing responsibilities, what are you to do as a nurse when it comes to ultrasound? For example, if it's an ultrasound for pregnancy, what you do is, like what I've been saying previously, you obtain consent from this patient and do well to explain the procedure to the patient so that the patient will know what this procedure is about. For people who are fearful of diagnostic procedure, you have to allay this patient's fear and anxiety, calm the patient, and assure the patient that the patient will be fine. And yeah, that's what you have to do. And then during the procedure, if you are the one who is going to carry it out, what you do as a nurse is you lay the patient on the bed, and then you rub a lubricant on the area to be scanned. And after that, you then use a probe to place on that area, and then you can move left, right, front, back to check for whatever you want to check. So that's that for ultrasound. It is quite easy and simple. The guidelines have been given. What is just there for you is to follow the guidelines, and yeah, you are good to go. You are going to scale and ace the exam. So this is the end of this video. I hope this video was helpful. I hope you enjoyed the video. If you like this video, please give it a thumbs up. Drop your comments if you want to ask any question. I am willing to answer. If you're not subscribed to this channel, please do. It is absolutely free. This is where you gain value, where I help you with anything nursing, in your academics, health, lifestyle, and that is that. So and also turn on your post notification bells to know when I post a new video, so you would not miss out on any of my videos. Thank you for watching up to this point. Share this video for anyone who you feel it's going to be useful to, and I'll see you in my next video. Until then, I remain Nursing with Annie. See you. Bye.